In our last segment tonight, I'd like to introduce you to some of the angels in medicine, Augusta Health's Hospice of the Shenandoah.
My father was diagnosed with a rare bone marrow cancer. I didn't know what to expect when the doctor said, "We'd like to recommend hospice." And I was just amazed at the service that was provided, not only for my father, but for me.
Hospice care is multifaceted because people are. So we deal with physical, emotional, spiritual elements of who a person is. You would have a nurse who would primarily take care of the physical problems, but also be very careful to listen to emotional things, what's happening in your family, what's happening in your life.
In hospice, we tend to focus on living. Hospice is about living the remaining days you have left as comfortably and as pain-free as possible. So that's our focus. And the team approach with all the different professionals in there, the care that we can provide, the education, the support, just walking that journey with patients and helping them every step of the way.
People who come to hospice are alive, and as people who are alive, they have goals and wishes and wants and needs, and so we work as a team to meet those. Often it's done at home, but we do have the Shenandoah House when it can't be done at home, when for some reason it's too much for families or the patient, or families live out of town. The Shenandoah House is a facility here on the campus of Augusta Health that takes care of patients in a residential setting.
We take a team approach, as I said, and we do the same with our families. We don't just serve the patient, the family, the caregivers, we serve them as a whole.
I didn't know that they would minister to me as much as they do to my father. And that has been the best thing of all.
If we are able as a hospice team to listen to provide care for, to provide respite for, to provide laughter and listen to tears with, if we provide all of that for a hospice family, then at the end of the hospice experience, that family feels that they've met the goal they wanted to meet.
To have hospice has been a blessing for us, huge.
Generally speaking, I'm their neighbor, and I'm taking care of my neighbor. And in the Shenandoah Valley, neighbors are awfully important to each other. And when people come to Hospice of the Shenandoah or to the Shenandoah House, most often they meet people they know. And it's people that they know and that the patient knows who's providing the care.
We are joined by Kristen Prenti, Augusta Health Community Services Liaison. Clearly, Kristen, for these folks, this is a mission, not a job.
Absolutely, and thank you for allowing me to speak on behalf of the Augusta Health Hospice of the Shenandoah staff. They are a great group of people that pour their hearts into their position. We are a local nonprofit hospice who serves the community.
And tell us, we saw just a full gamut of their great work. When should a family contact you about hospice care?
It's actually never too early to learn about hospice care. During the final stages of life for the patient and the family member, it's a very stressful time and a difficult time. So if you learn about hospice services now, then it'll be less stressful when you have to make the decision. What hospice care provides is care to those who have a 6-month or less expectancy to live. So the physician would work with you, and if you have any questions, you can contact the hospice department.
And does insurance pay for hospice?
Insurance does pay for hospice care. Most insurance companies cover it. Medicare, under Part A, the hospice benefit covers it, as well as Medicaid. So that's one less thing the family has to worry about. And we cover regardless of the ability to pay.
And I would like for you to be able to get a phone number in if families would like to contact you. What is the phone number that they can reach you at?
Absolutely. If you have any questions, our number is 540-932-4909. Once again, 540-932-4909.
Thank you so much, Kristen. And thank you so much for joining us. If you would like any more information about hospice or any of the subjects covered in tonight's program, please check out the Health First section of WHSB.com.